Hi, everyone. I'm Kristan Hawkins, and welcome to this new episode of the Explicitly Pro-Life podcast. And I want to introduce a special guest, in-studio guest with COVID, Gary Ingold. Gary is the CEO of Community Pregnancy Clinics, and you have been so generous, Gary, to let me use your all's facilities down here in Naples, Florida.
Yeah, you're most welcome anytime. Just remember that. Doors open.
Well, I was down here with my family this winter, and you graciously opened up the center for me to record these podcasts. If you've been wondering, where has Kristan been doing the podcast? It's been here in the Pregnancy Center in Florida. But there's something very special about what's happening down here in Southwest Florida, and it's because of what Gary and his team are doing at CPC. So I wanted you to share with everyone your model, because you and I were having this discussion last week. I get calls all the time, and we're kind of this is the perfect time to talk about this because this is season 3 of the podcast, and we're talking about having difficult conversations. So we're having all kinds of conversations with folks, and I get this call a lot from pregnancy centers who say, what are we doing wrong? We want to reach young people. We're not getting abortion determined women in the doors, but you all are doing that. You're reaching young people. You're getting abortion determined women. And so I think this is an important conversation. So you were talking last week and I was like, just stop talking and let's record everything you're saying because I want to share this knowledge and this wisdom and everything you all are learning down here. It needs to go across the country.
Well, thank you. I appreciate that.
Tell us your wisdom, Gary.
Yeah, I don't know about the wisdom part, but I just a real quick background on myself. I was a Naval Academy grad and a Navy pilot, and did 6 years active. Got out and I got into the business world for about 35 years in healthcare. With pharmaceutical medical supplies, and then also a lot of things happened during that time frame where my wife and I came to some realizations about the pro-life movement. We're part of that 60s, 70s generation, and so one of the things that we came to was the fact that certainly we were not being very good Catholics, first of all, and second of all, she brought me back to the Catholic faith, and the second thing was the fact that we had a revelation around the pro-life movement in about 1992, which just changed my life personally, and that's another story, maybe for another time. But just take it from me that it was a great moment for me that we had that revelation, and then the one thing that was saddest part about it is that we just wonder sometimes how many children should be sitting around our kitchen table, and a lot of 60s and 70s generation there have a lot of those type of regrets. And but then again, I know God is very merciful, and he's done great jobs with us and putting us on a path. So I started in the pro-life movement in probably about 94, more in the legislative part of it, and then worked my way to the point where we started doing. My wife and I told our story for many, many years. About our coming to the realization that we had been thwarting life for so long, and we were doing it without any kind of convictions. We weren't people that would say that we weren't ever to say to somebody that on the outside would say, if you want to have an abortion, it's okay. But for ourselves, we would never have an abortion. But little did we know that we were using the pill and we were having abortions all the time, correct? So I think that for myself, fast forwarding a little bit on this thing is that I take our way up to the fact that I finally had some more calling into the Catholic Church and the diaconate. So I went and became a deacon and was ordained in Buffalo, New York about 20 years ago. And that really got us going more into the pro-life movement itself, because every time somebody said, well, geez, who's going to talk about human sexuality? They always said, well, the Ingolds will do it because they're not afraid to tell their story, which was very bold in that type of thing. But anyway, that sets a stage for myself as to, where I am and why I'm in the pro-life movement. But I think that fast forwarding I turned 60. I had a very great job with Cardinal Health. I was a vice president and general manager. We had all the things that we really wanted in life. And I got called in and they said that we're going to do a kind of a shakeup on the top side. And which is not out of, everybody, anytime you get in that organization, you're going to have those type of realities. Bottom line is that at that point, I remember going home to my wife, Jenny, who's a great lady of 46 years of marriage. And I said, listen, we got a choice. I said, I can do this or I can get out of this thing. And then next thing you know, I said, let's do it. that night I went on CatholicJobs.com. And I said, you know what? I'm just going to put executive role into the system. And the next thing you know, boom, there was a CEO of Community Pregnancy Clinics that was on board there. And I looked at Ginny. I said, you know what? You mind if I just hit on this thing? She says, no, go ahead. Well, 4 months later, I'm the CEO of Community Pregnancy Clinics. And so the Lord said, you're not done at age 60. And so the last 8 years, I've been doing this with Community Pregnancy Clinics. Great organization. The one thing that really thrilled me about the organization is that when I interviewed with them, they really were wanting to, they saw that they had a model that worked and they wanted to expand. And of course, with that came the fact that, oh yeah, he's a deacon. On top of that, he's a big pro-life person. And I'd run some major businesses for the organization, and they said, well, you must be the guy that would know how to open up new clinics. But the strategy was this one, Kristan, and this was really the great thing. The board, we put a task force together, and we studied the state of Florida. We sat down, we said, where is the high chlamydia rates and gonorrhea rates and that kind of thing from STI perspective, and then where were the highest abortion ratios in the state? And so we looked around and we started we put a heat map together. Now the heat map would go, what would be red, orange, yellow, whatever it might be. Was yellow, it was probably an area where they were not having high abortion ratios, maybe in the 50s or 80s. And then we said, but the whole thing about our strategy was we needed to attack where the largest number of abortions were taking place. So one of them that for us was the fact that we had done a decent job is that through the studies we did right down here in Naples, and our abortion ratio in Naples is about 136 abortions per 1,000 births. But before I came, they had opened up in Fort Myers where they didn't really do a study. They just said, we think at that point, and this is before I came on board, we think that that's a great place that we maybe should get into. Well, we got into Fort Myers. Well, I can tell you the analysis, and this analysis we use, and it's the thing we use as a kind of a cornerstone for why we do what we do, is the fact that over those 10 years when we were in there, the abortion ratio dropped about 37% from about 405 abortions per 1,000 births to about 265 abortions per 1,000 births. And over that 10-year period, we also saved over 5,500 babies from abortion in that Fort Myers clinic. So
there's all those babies around that dinner table, by the way.
That's right, and those are the ones that I missed out on. But I know that once again they're all sitting around some great tables today because the moms make the choice, right? It's not us. We don't coerce them. We're all just trying to do the best and just giving the facts and the truth about what it's all about. But just going a little bit further now. So now I kind of jump in here. We put together this task force made up of very good people in real estate, people who were lawyers, people who had that creative piece in them about what we could do, statistical people, and that task force, we put together a strategic plan, and we marched that strategic plan into Bishop Dwayne to make sure he knew what we were trying to do, who's the bishop of the Diocese of Venice here, and a great pro-life bishop, and so he had an idea what we were looking to do. I will tell you this. I went and spoke in at St. Isabel's one day. And as I spoke over there, the guy said, tomorrow, I want you to call me. And so I gave him a call, and he said, Gary, I'm ready to fund your next pregnancy clinic. And so I said, okay. And at this time also, we had received a phone call about a mobile medical clinic. Now, we had never thought that the mobile medical clinic would fit into our business strategy, but the Lord once again had something else in mind for us. And so what happened is that the person who called me said, listen, I just entertained a bunch of different people, and they said the person that he lost his job, he could no longer afford to go out and fundraise and things of that nature, him and his wife. So they said, we want to give you a mobile medical clinic. And Kristan, I remember sitting there and going, why is this coming in here when we're wanting to put brick and mortars up all over the place? So we went ahead and we decided we're not going to stand in the Lord's way, and we took the mobile clinic.
Now, when God gives you a mobile clinic, you take the mobile clinic.
Yeah, because it's a lot of money for a mobile clinic, and I know that for a fact because now we have two, and they're very expensive. And if you put the right people on those mobile clinics, you're going to spend a lot of money too. So anyway, but we ended up what was really ironic is the fact that I went up to the bishop and met with him one other time. And I remember the talk. I'm not going to get into the talk, but it was I was leaving. He says, Gary, maybe you want to do this in Sarasota. Well, we looked at the heat map, and it was very hot in Sarasota. It was over 450 abortions per 1,000 births, and a lot more of the density of population that certainly would allow us to be able to render a service to more people and more of these folks. And lo and behold, I kind of put the two and two together because the gentleman that said he would fund the first one, he said, Gary, why don't you open in Sarasota? And so so as I walked out of the bishop's office, and he said, wait a second, he said, why don't you put it in Sarasota? I said, I went back to the board and I said, you know what? I think we should open in Sarasota and look at the heat map and look at all the stuff that's going on up there. Well, what do we end up doing? We go up there and we open. This is really funny. We end up I get another phone call from the guy who was head of the board for that one mobile clinic that we had just been given, and we were starting to put it onto the road. And he says, listen, I've got 2 homes up here right next to Planned Parenthood. He said, would you want to take a look at them? And meanwhile, so you take the bishop, you take this guy that wanted us to go to Sarasota, you get the mobile clinic, and you're saying, what do we do? And next thing you know, so we planted ourselves up in Sarasota right next to Planned Parenthood.
And this is a mega Planned Parenthood.
And this is a mega plan. This is the regional office for the 23 counties of Southwest Florida, which include now probably about 11 other Planned Parenthoods that report into them. And it's one of the largest in the country. And so, so we went up there, and this is the part from a business angle, if everybody's listening, is that I think it's important, and Planned Parenthood is going to probably be upset with me when I talk about this, but when we went in there, we went in and we knew we had to take and gut the whole clinic out, this house out, in order to make it, appropriate. And we went ahead and we held a capital campaign, and we looked for 24 founders. And we said we had figured out early in my career with community pregnancy clinics, it was about $720 to save a baby. Okay, based on operating expenses and the number of babies that we were saving at that time. So 720, well, we put it at 100 babies saved, and we sold markers at $72,000. We knew it would take us about $450,000 to go ahead and really build out a clinic always. And we looked at a strategic plan that had 4 clinics that we wanted to do through the state based on the heat maps. Okay. So that added up to about 1.8. We raised $2.5 million. And so we knew that the Lord really wanted us into this stuff. So anyway, Sarasota, the one thing we needed to do is that we were very, very, very cautious about the fact that if we put our name out there and it's right next door, and Sarasota is very liberal, that there's a potential for them to go ahead and stop us some way with this clinic. And so what in fact, the mayor of Sarasota used to go to the Planned Parenthood fundraiser. So we knew we knew they would get all the support they wanted to have at that case. So we went ahead and we created an LLC, and we flipped that home from a community pregnancy clinics to an LLC, and we named it. It took us a year, almost 15 months, to gut that thing and really make it into a clinic. And on the last day, we flipped it back to community pregnancy clinics. All our staff is there, and we opened it up in the June timeframe in 2017. And we rolled out the banner, and we were standing.
I would love to be there to see the Planned Parenthood.
Well, it was terrific, and so we're all standing out there. The nurses have all their outfits on, the whole works out, and the banner's standing out, and they were pulling into the parking lot. By the way, the Planned Parenthood there took up a city, 3/4 of a city block. That's how much property they had, and it's a 4-story building. And so it became known as David and Goliath because of our little building. And but when they drove into the parking lot that day, it was like their eyes opened up, and all of a sudden, within 10 minutes, they were out snapping shots. Within about 3 days, they were putting up all these black banners along the fence so they couldn't see in. They were doing everything they can to disgruntle us. And when it was all said and done, we took the police, and that was our fence, and the police came over and said, take it down. And next thing you know, they had to start dealing with us.
Yeah.
And And so far, that clinic has just been so super successful. It coordinates so well with the students. With the sidewalk counselors, and we knew that big city block, and with us being on it, that the number of people that were going in there, that we needed to cooperate. So I held these meetings at the Catholic Church nearby, three blocks away, St. Martha's, which just has endorsed us. Unbelievable. I want to put a shout out to Father Stampiglia, Fausto Stampiglia, just a wonderful man and priest. And so we held meetings there, and we just came to grips with the fact that you can't do this think about putting notches in your belt about how many babies you save. It's what we save together. Right. And so we started providing them with certain pamphlets.
And these are the sidewalk counselors.
These are the sidewalk counselors.
Because I think this is an important point, because I want to talk about the mobile clinic and campuses, right. Because I commonly hear from pregnancy center directors some of the pregnancy centers have an apprehension about working with sidewalk counselors. Right. But you all have made it work, and you're working together as one coordinated team. Right. So tell me so you're giving them certain, are you doing training, and how are you coordinating with them? Because I think this is important for anyone who's a part of a pregnancy center. You know, if you're an executive director, if you're on the board, you've got to be working, I firmly believe, with the folks there on the ground, because they can be your best marketers.
And that's exactly what they are. They're great advocates. What I think most people, once again, this is how we've made it be able to be humbly successful, is the fact that we took it upon ourselves to go to them versus them to come to us. We set the rules around HIPAA and what they could do and what they couldn't do, and they had to also understand that we necessarily could not always give them all the information about that. That client because of HIPAA, right? So we had this great meeting, Pam Stencil, and Pam is a great STI educator and an abstinence educator, and she's been with us. We brought her. That's another story that would take us too long, but it was a great story.
She's great. She's like one of the first videos I watched when I was at the pregnancy center, were Pam Stencil videos. If you were a child of the 80s, 90s, but as I was saying, we got to get Pam back out on college campuses because the phenomenon of these short videos and Pam Stencil will be fantastic. But keep going.
It is good.
That's in my notes for after this.
We'll talk about that one later, but I tell you what, she is doing great work for us up in Gainesville. Yeah. Okay. So, but back to the sidewalk counselors, is that when we got them together, I think they felt united because there was nothing there, and they knew the money that we had invested. And it was $175,000 to build out that clinic and make it so that it had the proper paint, proper atmosphere, and such that women come into a building and they don't need their self-esteem lowered by coming into a building. So many people think there's a light hanging from a wire and we don't care about them. Well, that's wrong.
That's the abortion facility, actually.
That's their side of it. You're right. They won't paint the walls. We'll paint the walls if there was a scratch on it, just to make it look good for these ladies, because they deserve that deep respect and dignity that they're coming into a good medical clinic. But back to once again, we met often. We talked through a few things. But that's the thing, is that we built a camaraderie together about what we do. They put out a very good detailed, and they being the sidewalk counselors, put out a very detailed itinerary as to who they spoke with during the day, how many people entered the building, et cetera. And then the fact that they transferred them over to CPC. And then it's that kind of cooperation. You just don't see that stuff. It's actually a marriage. It's truly a marriage. And we all know it's one thing we're trying to do, and that's to save a baby from abortion and take care of a mom and take care of father and make sure that we're upholding to our medical standards about what we're doing. We have 2 pro bono doctors up there in Sarasota. But I think the sidewalk counselors, we just continue to talk, and then we try to give as much feedback as we can so they keep themselves lifted in their spirits. Now, the one thing you have to do sometimes is that they don't have a funds. We create education funds for our clinics, all of them, so that we can give them cards themselves, because we want to work with them, not against them. It's kind of like your folks up at the Students for Life. Our building at the University of Florida is their building too. So we can create the greatest atmosphere of culture, a cultural life, by joining. I'm looking for always the person that I can get together and actually make a team out of this whole thing. But I think that you have to be bold and step out to the sidewalk counselors right across the street from where we're standing, 20 feet away, 20 yards away, is the Planned Parenthood across the street from this building. And while it's closed right now, there's rumor that it's opening again with 3 that we just saw it's just the fact that they were trying to save money during the COVID themselves, just like most places were. But I think the fact is that we cooperated with these folks too, and they would bring the people over. So we got the same kind of atmosphere. And I think it's more the fact that don't be afraid to sit down and have teams that get together, and don't be afraid that your idea is better than somebody else's idea, because we all have to eat some humble pie, and those sidewalk counselors have made us better counselors and better folks for these women. So.
So it's definitely you don't see, it's good communication, because I have seen some pregnancy centers saying, no, we want to be completely disassociated with pregnancy, the counselors out in the streets.
It's hard to understand that.
And I know, because I'm like, they're your best marketer. And I get that if they're out there and they're yelling at women, they're doing what we know is counter to helping the situation.
Right.
Of course you don't want to be associated.
Right.
I mean, have you had to deal with that as a pregnancy center director? I mean, it doesn't sound like Sarasota.
Not Sarasota, but
Fort Myers?
Fort Myers, we had the folks. No, the thing is, we had this. I felt that was one of the first things I had to do is gain momentum, not just around the fact of who we were as community pregnancy clinics, but also where could I get myself to where I would have the support myself. And so I went to the Knights of Columbus. I went to the churches. I went to, like I said, the sidewalk counselors themselves, the leadership of the sidewalk counselors, and we just worked things out. And there's a good actual old Naples pro-life. Father Orsi is part of that. You know Father Orsi? Father Orsi is the Catholic priest out of St. Agnes here, very open about his opinion about abortion, and is a beautiful man, and he's made waves, but he makes those waves is that he touches everybody in this community, which allows us to say, hey, let's get together, let's work together, and get through this. I know it sounds simple, but that's how simple it is. Yeah. Don't be afraid to just open your heart up and allow the Lord to work with each other. And I also think that we as pregnancy centers and clinics, I should say, is that we need to come up with the literature for them because they don't know what's going on here. Just like I needed to learn from them on the lines and how you counsel somebody that's going in. And I would never want that job, to be honest with you. I know. Okay, those are brave men and women. But at the same time, we've got a budget, and we're going to spend it on the sidewalk counselors so they are armed with the proper literature so that they can make good, sound decisions while they're listening. If they're educated on what goes on in our clinic, that makes them just that much more powerful. And said, you know what? Just one thing you just said there, that little clinic that's sitting right here, 20 feet away, they can help you. They can help you because of this. And then they said, but allow me to take you over. And once again, there's no coercion. They let them at the door, and then they walk away, and we take over from there. That's great. That's fantastic. And I've seen it work in St. Louis. They have a great model. St. Louis is beautiful. Yeah. I read more about St. Louis. Yes. They're a great place. Thrift, yeah. Is it Thrift? Thrive. And then Brian Westbrook with the Coalition for Life, and he calls it the St. Louis method. The St. Louis method, yeah. So I'm coming to mind. It's like I was working with the sidewalk counselors in Memphis, and they have a great Coalition for Life, and they're like, I said, well, how are you doing? They're like, we have
we're using the St. Louis method. So they have a whole name for their partnership, and it's great.
Right.
So, but I think this is important though, because I think a lot of pregnancy center directors have these questions, and I know so many of our student leaders who are listening. This is what they aspire to do. They aspire to take over your job. By the way, they want your job. They want my job, and they want your job. So I'm like, hey, come and take it.
Yeah, right.
But this is information that I think is very helpful. So, what about the mobile clinic?
Okay, I'll get to that.
How are you getting that to?
Yeah,
we need to spread this far.
Yeah, because I think everybody knows enough about the brick and mortar, pregnancy clinics.
Sure.
I don't want to make light of that, but the fact is that the mobile clinic really opened my eyes to the fact that we're places we could go places that you've never been before. And what happened is that we started to work with the smaller colleges and universities. In this case, Florida Gulf Coast University is probably the best example for us. And the fact that we started, I went over, we spoke with the medical crew. We got to know the medical director. We got to know the nurse there. They gained confidence in us by what we were doing. The mobile clinic, we talked about the fact that it's, the one thing let me tell you about the mobile clinic is that it's never going to save as many babies as a brick and mortar. Because there's more of a relaxation in a brick and mortar atmosphere. But when you this goes to the model, the university model, okay? If you go to the universities, they don't have a conscience about that at this point. And what we're finding is that when we got on a public university, Florida Gulf Coast University is a public university, they allowed us to come on campus. And so we got on campus, and what they were doing at one point, it got so successful, they were tweeting the campus off and on for us that the mobile clinic was here. Mainly what you find on the campus is that we're a good example of STI testing. And we'd find them standing in line, literally. And so we at one point before COVID hit, through about 7 months, we had done almost close to 500 STI tests.
Wow.
Now, STI tests, this is the one thing you have to realize, and maybe some of the people are listening here.
It's a little controversial, too.
It's a little controversial. But the point is that STIs is nothing more than another opportunity to be able to sit down and talk about beautiful human sexuality.
Yes.
And why, and also educating these young people about the fact that you have an STI, and if you and some of the partners, the number of partners that the folks have had. And I was in the Navy, so I'm not born yesterday, But the point is that the partners they've had, and then you show them the little card that shows how that multiplies, it goes out, is that they really stop and think about it. They really do. And we actually had.
It's actually pretty disgusting. Like from a non-religious standpoint, it's absolutely disgusting.
Yeah. It's once again, this is theology of the body, things of that nature. And I love theology of the body, but I'm not going to get into it, I promise you. But we're not here to. A woman's not for our own self-gratification, and we want to use people as objects, and vice versa in many ways too. But I think the key on this thing at Florida Gulf Coast University, and this I'll fast forward a little bit because I know time and stuff like that. What's beautiful about it is when COVID hit, they were so excited about the fact of our success with that mobile clinic on that campus. Meanwhile, FSW, Florida Southwest, opened up 4 campuses, had no medical program. And so we invited ourselves over to come over and talk with them. And they said, we don't have that. And you're doing STI testing. And so, you know what? So 3 of those 4 campuses, and we had Florida Gulf Coast University as an example. So you had a marker where we were having success. This is the type of stuff that the mobile clinic, you have to go out and you have to make your market. And what you have to do is we put on a map where are all the places we wanted to go. Catholic Charities, they'll let you on. You go to up to Wauchula, there's some of the immigrants up in that area. They'll let you on because I'll tell you what, Planned Parenthood will bring a bus out to Wauchula, and the immigrants, which is right merely in the interstate of Florida, where all your orange trees and lemon trees and tomatoes.
I've been driving
and all
back and forth with that.
Yeah, you see it. I live in Ave Maria. I go through the tomato fields every night before I go home. I want to pick a few of them.
That's what those are, tomatoes. I thought they were strawberries the other day.
No, some of them, some are tomatoes, some are strawberries. That is stuff. But back to the Florida Gulf Coast University. This is the coup d'etat. Is that when COVID hit, they said, you know what? You can't bring the van on because it's an event, and the events were all canceled. Okay, that's what they used. But he says, what you can do is that we're going to put you into one of our clinic offices. And so they put us into the clinic office, and we were able to work with the nurse. Their nurse would first speak to the client. The client then would come to us, and they were allowing us to do counseling, STI testing, pregnancy tests. They still are. So
that's incredible.
And it's almost something I really don't want to talk about out loud in some ways, simply because it's a public school. But the point is that we have helped them save money. So let's go to the business angle on this. But what we are doing for them with my RDMS, who's got counseling skills and the whole works, and she can take all those chlamydia, and she can do the bacterial, chlamydia and gonorrhea, and is that we're saving them money. And they actually brought a couple of people else to a boardroom one day, and they talked to us about that. So the point is, it's got to be a win-win. You build all these different things from marketing through creativity, and don't be afraid to ask. And so we're a church out here in LaBelle. And now he's my pastor. I'm a deacon. He's my new pastor at Ave Maria. He called me up one day. He said, "Listen, I got a bingo sign out here. I don't want bingo signs. I want a pro-life sign."
Yeah.
So I said, I took our graphics person, made up the sign. We sent it to him. He bought the sign. We put it in place, and now our mobile clinic it goes up there and sits. You got to create relationships with priests. You got to create relationships with pastors of church, things of that nature. You can't be afraid. And so what does that mean to you from a business perspective? It does mean that you're probably going to have to look for somebody that has those skill sets. You got to face reality. We have great nurses, we have great counselors, we have great RDMSs, but not all of them. I've got an RDMS and another one.
What's an RDMS?
A registered diagnostic sonographer. Okay. Medical sonographer. Okay. And so that's your highest one. You can also, just so you know, a nurse can do it through NIFLA. Yeah. NIFLA has the training. They do a very good job.
They can certify you.
Right. They can certify you. And that's only like a 6 or 8 week course. These are folks that we have went ahead and decided to hit the RDMSs. I'll tell you, at the University of Florida, we have not been able to find a pro-life RDMS up there. So what we do have is we do have a nurse, a very skilled nurse, and she's taken the training, and she's been doing at another pregnancy center in Ocala. She came out to work with us. She had done a lot of already ultrasounds. She's doing great work, and plus. Just a little thing on how can we be this spread out? Well, we also have made sure that we've got a couple programs one's called Momentum, which allows the RDMS to go ahead and, let's say a woman comes in, her boyfriend's out in the front, and all they're wanting to do is get our free services because they're going to have to pay at Planned Parenthood before they do, right? And what happens is that the guy, he wants the abortion, but he wants the free services first. And she says, "I want this baby." Well, then we bury it into her iPhone. We just transfer all of her ultrasound in there so she can walk out, which allows her to walk out. He can still have he may have his own thought about what he wants to do, but she's going to go back and keep thinking about it.
She's got pictures of her baby. She's got
pictures of it. She doesn't have to show it. He's not going to know what's happened. So we have that. And the other thing, too, is that we have 3 pro bono doctors, one right here in Naples. He's been with us for years, and he reads all of our ultrasounds. But we also have the 2 up north in Sarasota. Both of them are abortion pill reversal certified. Okay. And Dr. Kibo, he lives in Sarasota, but we also have, we've worked with the ultrasound folks to be able to electronically send the ultrasounds from Gainesville without him having to be there, so he can read them. Yeah. And then okay them.
So you've got the people, you've been building not only the relationships to get the mobile clinic in the right places, but you also built this relationship of medical professionals. What are the other, I guess, best practices? I mean, in terms of marketing, I am 100%, I've become a firm believer that we don't lack the resources in the pro-life movement. If Roe v. Wade were reversed and states would magically start to make abortion illegal, which we know some would, states like Florida would still be legal. We have a big fight on our hands.
Right.
And no one wants to go to Tallahassee.
No.
It's not a fun ride. But that's one thing I've learned is no one goes down here. You don't go up north. But I feel like we lack the marketing. So we did a research study with Students for Life just in January, asking 18 to 34-year-olds what kind of resources are available. What are federally mandated resources? What are the rights that pregnant parenting women have? Do you know, have you seen an ad for a pregnancy center or an abortion alternatives location? And it was bad. The results of the study were really bad. And that's where I actually think if, and we could find that person down here in Naples to give $1 billion to help make abortion illegal. We could find them. We need to tag team on that. Yeah. But I think we would need to spend $900 million of that $1 billion just in marketing, because we have marketing these resources.
Yeah. Well, the marketing research, there's a great lady, Janine Marone. I don't know if you've ever heard of Janine's Sport After Abortion. She started a program there. And one of the things that Janine and I are very good friends. She's a friend of our organization, Community Pregnancy Clinics. And she had done some market research for not for her business that she was starting up, Sport After Abortion. But it was in the town of Gainesville. Yeah. So we were able to, and I've seen the reports about how the women obviously are suffering from either an abortion, through a miscarriage, through a stillbirth, or the giving up of their own child. And I saw the results, and that Janine, once again, she was the one that certainly funded all these things, but she allowed us to take advantage of the work she had done, and it just made me. I realized that how scary it is out there for a woman, and I'm not placating or anything or making this up. I read it and I actually started crying because they had these were verbatim statements by women, and you see that research, and in that area, if that research comes out that way, then that's where you got to be. And what's beautiful about it, though, too, is that in Gainesville, and I know we're hopping around a little bit, and I'll go back to the mobile clinic if you'd like to, too. I can tell some more stories about it. But I think in Gainesville, it's allowed us. Janine called me up and she said, "I got some exciting news for you." She said, "We paid $10,000, and once again, folks, you to make money." You got to spend money, and make money means save babies and build a good human sexuality rapport out there. We paid $10,000 for the sign on University Boulevard, and we paid a lot of money for the facility that we have there. That's just 500 square feet, painted in orange and blue colors. We've got the smart TV that and a big conference room that overlooks the campus. The football stadium's 200 yards away from us. The bars are on the street. The churches are on the street. Fraternities outside our right window. St. Augustine Church is next to us. The point is that you've got to build a marketing plan and a strategic plan that can what you're going to have to spend, and then you got to have the conviction to want to go out and ask the people for this money based on that scenario. And the marketing plan and all that strategic plans you have just add a lot of confidence to a donor seeing that you have something and you studied the program. Janine has studied that program for us in a better way at Gainesville and allowing us to be able to, first of all, share that data, and I really appreciate it, and if she's listening. And then the other part is the fact that for us, the latest one she did, we were only open for like 9 months. They asked, "Do you know if there's where Planned Parenthood is?" Or they asked, what are the places that based on these 6 entities? And Planned Parenthood was on there. Well, most of them knew Planned Parenthood, but just in those 9 months or 12 months we were open, we were up to 26% already. That's sound low to you. That's significant in 9 months. Yeah. So the word's getting out, that type of thing. But the word is also getting out in the sense of, and I want to give you kudos here, with Ryan Newhouse, who was there last year. Ryan, I remember meeting. We sat down. We had lunch together.
He was the Florida Regional Coordinator last year.
Yeah, Florida Regional Coordinator. And we were out. We were hitting the young Republicans. We were hitting. And Pam Stencil's up there. We were just doing. We brought Dr. Nadal in to the pro-life medical students. what I'm saying from a standpoint, not just focusing on gains, but anything you're doing in the pregnancy clinics, the centers you're doing, the mobile clinics, your strategic plans, pro formas that you put together, which are financial, so you know what you're having to do. Donors, be able to approach them in a certain way so they say yes to this program, and then you have to execute the plan, and that's one of the hardest things to do. And so you just know that it's not easy, but some people have their own clinics, and that's fine. There's ours. We are trying to affect the state, and I'll go and let me tell you why. Is because when you look at the University of Florida in Alachua County, you'll find that the chlamydia rate is the second highest in the state. And you look at the abortion ratio, it's over 500, it's about 560. So then you look at another study that we did, and that study was how many students come to the University of Florida. First of all, remember the University of Florida is the 5th ranked public university in the country. It's like an Ivy League public university. And there's great students there. It's a great campus, everything else. So there's 55,000 students, and this is where I come into the university model piece, where it makes sense. The university model piece is that 55,000 students are coming to that university every year. Of that 55,000, the further study we did is that 85% of them are from the state of Florida. And then we went ahead and said, where are they coming from? And so if I had the heat map of the state of Florida, you would see they were predominantly coming up from the Miami-Dade area. And then you saw the next hotspot would probably be from, around the Sarasota area. And then Duval County up in Jacksonville, that area is pretty hot. Anyway, we had those students are all flowing in the University of Florida. Of the 85%, I said of the 55,000, 71% of that 85% that are from the state of Florida, they go back home.
It's like California. Live. They stay. They
stay. They don't leave.
I mean, you got beaches. Yeah. Why would you leave?
So why would I put 18 to 24-year-olds right at my front doorstep? Why would I go and open another clinic in just some godforsaken area that no study has been done, and we put a $36,000 ultrasound machine in there? I want to be accountable. We want to be accountable for everything we are given, and I'm not saying nobody else is. I'm just telling you from my perspective. That's what's very important because these are things that need to be used all the time, not just part of the time. And so anyway, also here's the coup d'etat. There's Santa Fe College, which is a community college 4 miles away, 21,000 students. So we have at our beck and call 76,000 students from the state of Florida, educated, right, getting education, but they're off. 85% of them are from the state of Florida.
And you've got them in their neighborhood.
They got in the neighborhood.
You're right there.
Yeah.
And then when they leave, they're also going to know about CPC and what you're doing.
Right. And they're going to go back. Our ultimate is not to be there just to be a pregnancy center and be a counselors or STI education and then go out and bring all the speakers in and things of that nature. But the one thing we're embarking on is a great campaign and it was in our strategic plan. And that was when we did the study at the University of Florida, we did realize that we were going to have licensed clinical counselors go the step, because you've got date rape, you've got all these very severe things. So we're in the process of hiring a new a clinician, a licensed clinician, and our thought to our donors was that we would use telehealth. We would do telehealth. So they're saying you're going to put an XYZ and that many different things, that place. No, our whole thing is to do the telehealth. They can, but we have to be on the campus where we got the greatest number of people between 18 to 24. Which is your highest abortion ratios, and that's your highest chlamydia or gonorrhea rates. So anyway, I'll stop. That's the university model.
Okay. That's a lot of nuggets of wisdom. So I'm trying to in my head, what have we learned today? So just for everybody listening. So build relationships with the community. Don't be afraid to go out to the sidewalk counselors. Right. Create the literature. Don't let, because you know more about the model than they do. Don't be afraid of doing STD testing, which, why do you all call it STI testing?
Actually, it's the new way.
I know, but why is it
one's disease and one's infection.
But why is it STI now? Semantics. Because that sounds less scary than disease.
Oh, it does sound, yeah, you're right.
I know. I stubbornly use STD, and all the pregnancy centers now are using STI. I'm like, it's STD. So, but I know why you have to do it. But the STD testing, we should not be afraid as a movement to engage in that, because
Stay in the bacterial side.
Okay, stay in the bacterial side.
Because if you go into syphilis, now your blood, you had to draw blood.
And that's a different regulations.
Now you're getting some different. You've got to. Everything changes there with the regulations. We'll just put it that way.
Yeah, the regulations.
Okay.
So don't be afraid of the STD testing. Don't be afraid of the mobile clinics.
No.
And build relationships. So, because I think what I've heard, I get calls all the time from centers who have gotten a mobile clinic, but then they're going, no one's coming into the mobile clinic.
Oh yeah.
And so I'm like, I don't know your community, you can go out in front of a campus, but you're saying you're not really having a problem on the local campus. People are waiting to get into the bus because they want the STD testing. And that's not really I would be like completely ashamed if I wouldn't raise my hand, be waiting for a public bus, but there's not that same level of shame associated with it.
Well, the other thing too is you got to think about their parents can find out on the other side of it. It's
That's
something
true.
else, things of that nature. So, and I think the mobile clinic itself is wonderful to bring into places where the place that's like, let's say, an indigent care or things of that nature, or the Catholic Charities places out in Immokalee, you sitting there just raises these people up again. The fact that there's a clinic there that if I get pregnant, I can go get.
There's help. And so you're building that long-term relationship, just like what Planned Parenthood does in schools. And the other thing we learned is don't be afraid to go into the campuses and be at the campuses. Are you guys going now? This is the other thing that Planned Parenthood does in their predatory business model is they go into the high schools and they go into the middle schools.
Okay.
So I assume you got that one covered too.
Well, Pam actually is a contractor for us. Pam Stenzel's been with us for 5 years, and that's a story, like I said in itself, how we got back together. But it's a beautiful story. And Pam is if you were to go to our annual report, we're very transparent about our stats and everything we do. You'll see that in that annual report is Pam Stenzel with how many students she has touched through our organization. And she
goes on schools. And what does she do on campus if you've never watched a Pam Stenzel video?
Well, Pam will get up there and she'll, first of all, she'll calm everybody down. And then she's got that energy that she'll never believe. She's a great, great lady. But she's educating based on the fact of beautiful human sexuality is a beautiful thing. It's not a disease. It's not something bad. And then what she does, though, is make sure that all of these students understand that why it's so beautiful to save yourself for someone else, the beauty, but also the sexually transmitted infections that she talks about. When she reads them off, I think there's like 32 now is what it is. There's not just 2 or 3. There's 32. And some of these things, she makes it very apparent to them that, young ladies, here's the deal is that you could have scarred fallopian tubes because of chlamydia and you never got to treat it. And then when you find the young man of your life and you can't get pregnant, and then the doctor said, you could have, looks like you may have had chlamydia, and I mean, first of all, I'm sure the guy would have, whoa, if he doesn't know you really well from your past experiences and things like that. But that's not the point. The point is the fact that to educate early so they question, so they go home to mom and dad. Pam will also, I know this with my son real quick. My son saw her 18 years ago. It changed his life. He came home that night. He says, Dad, they're inviting the parents. Pam will speak to the parents tonight. I said, well, I was interested. So I went up and I walked away from there and I said, I can't believe what I just heard. So the parents are also getting educated so they can sit down and have that conversation. That is always one of the most difficult, the birds and the bees.
Yes.
It's so difficult and it's so distorted and so
I've started having those discussions with my 12-year-old, and it's already getting uncomfortable.
It's already,
house,
right. But Pam Stencil will come in and lead with that. Bishop Dwayne has allowed her to go into all the high schools here.
No. And then she's passing out. Yeah. And so she'll be passing out community pregnancy clinic information.
She can also do that. She mentions the fact that she contract with us. And we've had her for 5 years. And she's probably, at this point, if I go back to our annual reports, she's probably somewhere over 25,000, 30,000 people she's seen.
Yeah.
And can I tell you why we brought Pam? Because the first day when I got on the job, I went looking at Knights of Columbus. I sat there and I talked about community pregnancy clinics, and an old crusty guy stood up and he said, "I got a question for you." And I said, "What's that?" And he says, "What are you doing on the front end to keep these women from even coming into your place?" And I went back and I got to the board and I said, "You know what? This guy's right. We don't want people coming in here. I want my numbers to go down, not to go up."
That's right.
And so what we did is, what happened to Lord? Pam rings on the phone to our board chair, who she knew from many years ago. She was moving down to Florida. I said, "We got to get Pam."
Like all good Midwesterners, she's in Florida now.
Yeah.
The whole Midwest is here, by the way. It's a party. One of our staff members ran into one of her friends at a hotel lobby yesterday. They're all here. If you wonder what Midwest is, they're here. But no, I think that's fantastic because you guys are you're reaching the target demographic before the crisis. You're there on the campus. You're not afraid of the STI testing. You're working with the cyber counselors. You've got like the whole gamut. I'm sure you're running digital ads as well as traditional
Google ads with heroic media. Yep.
Exactly.
We got the bat phone. It's right over there. It's a hot one. We know. We saved about 3. We were actually the beta site for heroic media in February of 2013 with the Google ads. So we saved, it's over 300 babies we've saved through that program alone.
That's unbelievable. So you guys are doing remarkable things. So you're here in Naples. You're at 2 locations. You got a location in Fort Myers. You've got the location in Sarasota. Now you have a location in Gainesville.
And the mobile clinic operates out of the Sarasota, the northern part of our geographic area. And then we got one down here right out in Naples.
Yes.
Same thing. Can I say one thing? Is it, here's the thing, is that don't be afraid to tap your donors' expertise, not just their money, but their expertise. All of the people that were on our board are folks that had that skill set that we needed, that we didn't all have. And we just brought on to our council, not the board, but the council, Steve Mosier.
Yeah. I saw Steve last night.
Did you see him? Okay, great guy.
Everyone's down here.
Yeah. So Steve, and he lives out in Navi now. I didn't even know he lived there. But Steve told a story, and in light of the administration that's here today, we need to Steve Mosier to tell this story, because what happened in China that he observed, it's the whole thing, is just so mind-boggling. But it could happen here.
That's right.
If we don't do things politically correctly, and also from a human standpoint.
And we have a president now who is now an apologist for China, who literally on a public stage said it was okay that China was committing genocide. I don't know if you saw that.
I didn't see that.
So they asked him about the genocide that's happening with the Muslim Uyghurs.
Oh my gosh, you got to be kidding.
And he said, well, you have to understand something about the Chinese population. Anytime they've ever been attacked, it's because they're not unified at home, and the Chinese government just needs uniformity. He apologized for a genocide, for systemic rape and torture. So, whatever's happening in China could very easily here, because apparently our president is China Joe and is directly very frustrated by it. It's explicitly pro-life, but I'm trying not to curse during Lent. So it's kind of like I don't know what to do here, people. So thank you guys for tuning in today for this conversation.
Thank you,
Gary.
so much.
Thank you so much for coming in.
I appreciate it.
This was a great conversation. Like I said, I was taking down mental notes the whole time. I hope you all were. If you have a friend who's involved in the pregnancy center movement, or you're on the board, please refer them to this podcast episode so they can look up Gary, what he's doing here at Community Pregnancy Clinics, and what the whole team is doing here in Southwest Florida. And you know what? I bet you could come by for a great vacation and stop by and see one of their clinics. I mean,
nice and
Sarasota has wonderful beaches. I just want to say, we found a shark tooth the other day. So my family is super happy being down here in Florida right now.
Can I say something nice about you?
Oh,
Students for Life, I think is on those campuses is got to be there. That education piece is so important. So thank you for all you're doing.
Well, that's That's a great motivation for you. If you're in a Students for Life group, you've got to work. Right. And why we always say, the first thing you do when you start a Students for Life group is you got to march your butt down to the local pregnancy center and introduce yourself. You're
welcome any day, anytime.
Awesome. Because we have to be in partnership together. So thank you all for tuning in this week, and join me next week for another episode on Explicitly Pro-Life. Bye.